how we have been working together, how that's going, how we can connect more to that, how we can just get stronger together and know about each other, and then tweak all the work that we're each doing to be more efficient and effective, and most importantly, more compassionate. So we're going to be looking at the collaboratives that have been forming over the years. I'm going to give a little history. When the faith-based initiative began with the city in 2017, we asked the community, the faith community and nonprofits, community groups, just like the leaders who were invited to this gathering, what their greatest community concerns were. Out of those concerns, then we also asked the same group of people, okay, if we're going to be working more together in these directions, what will we need to make that happen? And so the one answer was technology, which we did a lot of conversation around on what does that mean in terms of technology. And it really was about communication and connections. We don't know where the resources are. We don't know what each other is doing. How can we find those? How can we greater connect? So in that first year, so all that happened between like February and April. So we're almost exactly at that same point in time. After those things were discerned, we formed teams around the top 9, actually 10 categories of community concerns, one of which became technology, communications, and connections through that. So we called them teams at the time. We could still call them teams, but we've also, through research, best practices have found that within teams, what really makes the difference is that we're collaborating. So when we're talking about community collaborations right now, and we could even talk maybe organically or in terms of evolution, but those teams have morphed, changed, evolved, integrated, done all sorts of different things. And we're going to be talking about how those have gone in different directions in different ways for the greater good, and to have formed now into what we're calling collaboratives, specifically community collaboratives. So that it's, people living in the world like we all are, but from partnering with the city, faith organizations, congregations, nonprofits, businesses, universities and colleges, anybody who is wishing to step up and be a part of being the change, being the community that we want to see in the world. So that kind of brings us to this point. And what we're going to do, I sent out with the invitation yesterday, a document. It's not a fancy one, but what we have found out, it's entitled something like Why Community Collaboratives. We're not going to look at it this morning, but I invite you to look at it. In the first part of it, some of the discoveries that we have found and benefits of why these collaboratives are so healthy for us. And following that list, there's also then a list of the collaboratives in pretty much the order that they have been engaged. And so we're going to be taking those collaboratives in that order, from the initial teams into collaboratives, and in some cases, like today, forming a 501c3. Now, that's not the aim of every collaborative by any means. So just like any person, each collaborative continues to grow up and mature and does different things and becomes different things. And so I think that's as much a part of this story as what we're going to be hearing about each of the collaboratives and what they've been contributing in the world. The one thing I do want to say about how important this work is, our outcomes and the things that, I would say, the community that is being formed around these efforts has been noticed and is being lifted up this weekend at the United States Conference of Mayors. Their conference is meeting this weekend in Reno, of all weird places in my head, but in Reno. And all the mayors gather, or many mayors do. I doubt if all of them make it, but many mayors will be gathering. But the US Surgeon General on Sunday will be speaking as well as leading a panel. And they will be talking about isolation. They're going to be talking about collective trauma, but mostly they're going to be talking about ways and means where those things are being addressed. And the one example that they're lifting up are the community collaboratives in San Antonio. So our mayor is a part of that conversation and a part of that panel. So I want you to know that it is no small thing that we are doing together. And again, in memory and in dedication to those lives lost in Uvalde, we're going to keep moving forward, and we're going to keep getting even more prepared, the best we can be every day. And so that kind of gives you the history, the big picture that's brought us to today. And the longest running collaborative, close to, is the one that was developed around resourcing and technology, because that was discerned as the greatest need. And if everybody could turn off their mics, that would be really helpful to keep down the chatter and noise on the side. So I'm going to now hand this, first I'm going to take a survey. So, and you can just use your hands like this. I'm curious, and I'll ask this each time, how many folks, who hasn't heard about the San Antonio Community Resource Directory, also called SACRD.org? Who's never heard about it before? I'm watching my screens here, and some of them are blocked. How many folks think you know all about SACRD.org? You're good to go. Yeah, Keith does. He does all the entry. Of course you do, Keith. Okay, that means that, and Bill, thank goodness Bill knows. So I'm going to turn this over to Bill Neely. I'm going to be asking him some questions. And so this is our first collaborative. It was called something like the, I don't know, the technology team or something like that in 2017. And it is now a 501c3, stands on its own. Bill, why don't you, I'm wondering, if you were telling someone about the work of the Community Resource Directory and they'd never heard about it before, and you know, it's that elevator speech, right? And you're in an elevator with that person, how would you describe this resource and this community effort?
So, well, I use a very simple sentence, which is that the San Antonio Community Resource Directory collects, we identify and collect information on every human service program in Greater San Antonio. And that, and usually when I'm talking to somebody that's working in the human service field, that at that point their eyes kind of open up and they're like, oh, that sounds really great. And when I'm not working with somebody in the, if somebody is not, in the social services field, then we dive deeper and we start talking about, do you know where the food pantry is in your neighborhood? If somebody came into your congregation or into your office and needed help with dental care, would you know what to do? And SACRD is the answer. SACRD is what you use to solve problems like that when you don't know what to do. So SACRD is what gets you out of that moment of not having anything to share. So that's usually how I describe it. And usually by that point, most people have got it, and then we move on into more details about what we can do with all that information. So, which goes way beyond just a map of resources.
So what would you say? There are a lot of directories in San Antonio, right?
Yes, there are.
Lots of different directories for good reason, right? What makes this directory, this resource unique? And why is it important to the collective work that we're doing?
Sure. And I think, first of all, I don't think there should only be one. I don't think that sacred.org should be the only directory out there. I think that, I look at some of the other services, the 211 service is really good. Findhelp.org has some good resources. There are some directories out there that I think that, the AACN is forming up, and they have a particular component of service that I think is something that's hard to replicate. So I don't think that SACRD should be the only one. So, and when we started, we said, we were very clear that we didn't want to be, we did not want to be a competitor with 211, right? We didn't want them to view us as a competition or vice versa. And we actually had a long conversation with them about that. But we did want to compete with all the notepads, all the people out there that have, notepads in your drawer of all the things you found, or, the document, the Google Docs document where you've made notes about all the places you found. Those are our competitors. We want to get rid of all of those individual stores of data that aren't available to be shared with the community in a meaningful way. So really that's where we focus, and these other services, 211, they have a call center. It's run by the state, but they have a call center that is hard to replicate. It's very expensive to operate a call center 24 hours a day. And they've got backups in other cities. It's a state-run program with 25 call centers throughout the state of Texas. In San Antonio, Bexar County is operated by the United Way, but that's not the case throughout all of Texas. But so we don't want to be in competition with them. But one thing that sets us apart is that each of these directories has a uniqueness to them that the others can't replicate. So SACRD cannot replicate the call center function of 211. That's just beyond our reach. But SACRD can be more inclusive. We can include small faith communities, because we have ways of because all of our searches are proximity based. We can include smaller faith communities that maybe can only serve 1 or 2 zip codes, or maybe they're only serving a couple of blocks around their campus. St. Vincent de Paul, for example, we were able to actually draw on the map, what their service area is, for those conferences. So that's the thing that SACRD can do that the others can't. The AACN, for example, which is run by a for-profit medical services company. They have a piece of software that allows them to collect private PII, so private personally identifiable information on people, and do a common intake process that then can be shared across agencies. And so, there are and that's not something that SACRD is in a position to do today either. And so, each of these services has something that's unique to them that not everybody needs necessarily. Not everybody needs a call center. Not everybody needs common intake. But when you need it, it's good to have that, right? It's a big enough need that there needs to be somebody that's filling that space. But SACRD, we're really all about inclusion and self-availment. So we include everybody. Because we're a nonprofit, we can put whoever we want in the directory, and we have policies about who that can be. And then we're all inclusive for anyone in San Antonio or Greater San Antonio that's doing compassionate work. And then we have a self-availment model. So if you want to come and use SACRD on your own without having to rely on someone else to help you, then we're there for that. And we also facilitate case managers and social workers doing that for you.
So what I hear in all of that, Bill, is that anybody can use this directory, this resource. So people who are providers, but also anyone in the public. I can do it, you can do it. So it's open to anybody. It's in proximity.
Right.
So it finds things that are close to where those things are needed. It also is more granular. So there are more organizations in it that might be smaller, but that'll make a difference, to 1 to 3 families. That makes a difference. But it also has like the big dogs in it, the major entities that are doing the work. The city information is in there as well. So that's what I'm hearing. So not all the other directories have those things. but SACRD doesn't have a call center. So
Right.
what would you say, Bill? And the screen is open, so if for some reason you want to share directly so people can see, what would you say are the major accomplishments that have happened with SACRD, and what are some things that are in the works?
Well, so I will say that we've talked about this in this group before, but the mental health portal, I think, is a major accomplishment. And that when we set out to develop that, it was partially us recognizing that the mental health care needs that were coming down the pipeline because of the pandemic, but also in response to growing ideas and budding collaborations, bridges to care, for example, and things like that, knowing that those organizations were going to need resource availability in order to be really successful. And so we were trying to respond to that. But the mental health portal, I think, has been probably one of our most major significant accomplishments in the last year or so. And this was launched in October of last year of 2021, and it's being used about 700-800 times a month for people to seek mental health care resources. And so I think this is significant. And what it does is essentially we collected all of the mental health care resources, and then we allow you to answer a series of questions, what we call the guided interview, which is a series of filters, but allows you to really put in information specifically about your situation. What am I dealing with today? Where am I living? What are my payment options? What language do I need? What kind of group composition? What age range am I after? And really lets you find something in a list of 1,400 services, lets you find the organization that's closest to you that can treat your teenage child in Spanish and take Medicaid, right? And so we've really narrowed it down, on those things, and so I think that is significant. What goes beyond that is that this has given us a model in this what we call the portal treatment, has given us a model to really begin to address other areas of service. So we're attempting to apply the same concepts to housing services, where we have an idea for how we can be an information repository in the midst of community emergencies. For example, this past week, when the Uvalde situation came out, there was a lot of questions about what can I do, what should I do now, how can I help in Uvalde. We were able to collect some resources and get that information on our front page. We were also collecting information about how do I talk to my students about this. We had a full set of resources for teachers that we did not create, but that we collected through our email channels. That was being passed around through email. We were able to take that out of email and put that into a single place where it's now available to everyone in the community, not just the email chain. And so we're able to do things like that very rapidly in an emergency situation. We think that we have a place in other types of community emergencies where we could do that same kind of work. So I think that those were significant accomplishments and really helped us to understand how SACRD.org, at the end of the day, it's got to be more than Yellow Pages. It's not just a Yellow Pages of compassion, right? It's got to be more. It's got to be a change agent in Bexar County and Greater San Antonio. We have to be able to do something that nobody else is able to do. Otherwise, people will just say, well, why don't we just use Google for this, right? So we have to be able to do that. The concept that we're working on in what we call gap analysis is really significant as well. And this is, by virtue of knowing where all the services are in San Antonio, we can turn that around and we can show where the services aren't. And so now we can, and we showed this in this group, earlier this year where we did work around grief resources and domestic violence resources. So we're able to take, data sets from multiple sources and put them together with our data and then yield actionable information that can tell people, where do I need to focus my time and attention and money and policy to address the problem that I'm interested in. And so that is a growing thing for us, this gap analysis. And I think a very exciting thing and frankly, none of the other directors are attempting to do that. So I'm very excited that is going to be something that we pioneer in addition to these portals and and the continued collection of data. So we have to keep our roots. Ultimately, we connect people to a service. We connect someone with a need to a place that can help, them with that need. That will always be our goal. But these other things that we do can make us more efficient in help in that goal, but as well as it's just impacting the community in a greater way.
So it's also, in a sense, the most direct access to the direct services that are out there.
Right.
How many, this is a quick question, how many visits does the site get?
In 2021, it was 250,000 over the year, and it was 25,000 in May. So it's actually growing a little bit over the years. We had we get some common uses. So over the pandemic, we were actually a very popular site for people finding testing locations for COVID tests. People were actually coming to our site to find those things. We get a lot of traffic for AA meetings and AA recovery meetings, and we are very careful to communicate effectively with AA to make sure that we're listing their services in a way that meets their needs, right? And so, but we get, but it's running about 25,000 visitors a month, about 800 a day of people using SACRD, and this is professional users and case managers and social workers as well as individuals.
So it can also really be seen in terms of like prevention, like people without having to like get into a larger system, maybe. I know that SACRD is also looking at a housing portal similar to the mental health portal, but for housing, emergency preparedness, which would be really helpful for weather things, but also for things like last week. So those are some things that are coming up. Two last questions. So we get the information out and then we can go into conversation, but it's 8:25. So to both sides of the coin here, Bill. So how can the folks here, that's not the question. How can the community be more involved with this particular work? And then the leaders, how can they help with this work? So is that clear?
Yeah, I think so. And you opened the meeting today talking about the collaborations that have developed, and SACRD was a collaboration that came from the faith-based initiative work. But we tap into those collaboratives as well. And so the housing services portal, we don't call it a housing portal because we're not building housing. And so we want to make sure that we are clear about that. But we're into housing services, things that help people either obtain or keep their housing. So we call it housing services, but that is a collaboration as well. We need these collaborations. SACRD, strives to be in all of the collaborations that are listed on the document that you shared. That is something that we need to be in the community. 800 people a day using SACRD. We need to know who they are, and we need to be talking to them and hearing from them, right? And so we need to be in these collaborations and in the community. One, so that people are aware of SACRD and can use it to solve their issue or to help their problem. But also, two, so that we know that whether or not we're being useful, and if we're not being useful, what do we need to do? And if we're missing something, how do we add? So one of the newest features we just added to SACRD was a share button that allows you to send a text message to someone using the directly from SACRD about the program. And so that came directly from a user asking for that feature. And so what we need from all of you is to invite us into your collaborations and tell us what you need to make your information wise to make your collaborations more successful, and then tell us what you need from SACRD. How can, if we're missing a feature, if we're missing services, tell us about those. We've got a feedback form on every page that you can click to tell us if we've got something wrong, or there's a what are we missing link that you can use to fill out if we're missing something that you know about. So really I think that's where we serve you, is in making sure that we are up to date and focusing on the features and information that you all need.
And I know SACRD continues to talk about, this is a community effort. Even though it's a 501c3, you know, there's a board, everybody's working, it's San Antonians working for San Antonians. So we've got some questions, Bill, but before we go there, it's 8:28. And so for folks who are needing to depart at this point, thank you for being with us. Our plan next week is to look at what worked and what's happening in terms of homeless collaboration. And that took a different route and more a route of integration. So we'll be hearing about that next week. So thank you for being here this week, and we're going to stay on until 8:45. So I noticed that Kendra has her hand up, and so I'm powering SACRD a bit here. I'll look at chat, Bill. If Kendra, open up your mic and tell us what you're thinking.
Hi, I was about the house portal. Sorry, it's early. I'm not dressed yet, but are you going by areas where they have equitable housing, or is it just going to be housing across the board that's available? Because I think there's a huge issue with housing equality, Antonio, and to identify places where you would have landlords or housing that would be more equitable for people with financial issues or have been previously incarcerated or need a second chance property would, I think, be extremely helpful.
So we're doing all of that. So this is housing services, right? And so one of the housing services that we're focused on is helping people find housing, right? So, but there are several initiatives that are underway to do that. And so we are trying to, you know, the city has actually funded a project called Housing Base that is designed to do exactly what you're talking about, to help guide people into a housing situation that meets all of their needs, that is equitable, that is affordable. And so we are supporting that. As that project develops, we have other ideas about how we can collect information on housing properties that can interact with potential tenants that have, you know, that were formerly incarcerated or that take pets or that have particular housing, you know, family situations, you know, that require certain sizes and types of apartments, accessibility and good design of you know, barrier-free living and things like that. And so we have a partner that has collected a lot of information about individual apartment units that are, you know, affordable apartment units and has collected most of those attributes around them. And so we're working with him to get that information onto SACRD. He currently publishes it on his website. It's My City is My Home, and he's got a great map of those things. But we're working with him to bring that into SACRD so that it can be, you know, in a more accessible place.
Bill, so that was My City, My Home.
My City is My Home.
Is that what My City is My Home, and that's online?
That's online, mycityismyhome.org, and they've got a renters tab where they have a map of affordable housing locations in San Antonio, apartment complexes, and you can filter that map out by, you know, whether or not they take pets, if it's all expenses paid, if it's, you know, if they, you know, will rent to people with criminal background, things like that. And so you can look at that, and they update that map quarterly, and we're actually working with them to put it on SACRD in a way that where it can be updated, you know, more rapidly than quarterly, and as they collect information, it would be available immediately. So that's underway. So you know, that's not done, right? And so, you know, don't get too.
And what was the grant that the city passed, or the program the city is funding currently? What is the name of that?
It's called Housing Base, and
Okay.
and I don't think they have a public available demo yet.
Yeah.
So Bill, will that be linked on SACRD? We have more questions. So
yeah, sure.
Will that be linked on SACRD?
Yes.
It probably will.
So yeah, so, you know, in the housing services, we're talking about things like, you know, not just finding a place to live, but staying in your housing situation. Maybe you're an owner and you need help staying in a place. You know, maybe you're an older adult and you need help aging in place. People that need minor repairs, people that need major repairs, people that have legal issues. We're talking about, helping with transfer deed on death, you know, planning estates, you know, heirship and things like that as well as, selling your property, buying property, being educated on being a homeowner. So we're covering the broad spectrum of housing services, not just affordable housing. So affordable housing is one component and a very major component. But we want to turn the housing services portal into the one-stop shop for all things housing.
Okay. Bill, I'm going to invite shorter answers. We got
Okay.
questions. So how often is SACRD updated?
We update every program at least once a year, and often more, and usually more often. There's a feedback link on every page that we get information back, and so as soon as we get that, we'll update it. But it's at least once a year, and usually more often.
All right. How has SACRD been incorporated into the city and county directories? Do the county and city use this directory?
Yes. The
You
city
don't have to be that short.
I know that the city, particularly through Department of Human Services, which is where we grew, it's used extensively throughout those departments, and we've trained people, in those departments to use it. So the homeless hotline, the senior centers, the libraries have received training on SACRD and use it very effectively. So if you go to a library and ask for help with sacred.org, they can help you do that, and they also use SACRD to handle queries that they get from people that, we're going to find an immigration class or a citizenship class or GED program, things like that. So yes, we are used extensively within the city. The county is growing. The county that's a tough nut to crack, and so but we're working hard on that to make sure that they recognize that even though it's San Antonio was in the name, that this is really greater San Antonio. And, and all of San Antonio was in Bexar County, by the way. And so, but yeah, we're used by all of those organizations. And
does SACRD work with the fire department and the police department?
Not as much as I'd like to. The Hope team, which is an ID recovery program, is a SAPD program, and is the single most viewed resource on SACRD.org. So we do have that kind of interaction, and we do hear from some of the people on that team and related with that program that they're using SACRD extensively. But I do not have a formal relationship with SAPD or with the fire department, and I really wish I did. So if anybody here can help me with that,
we can do that. Is there, David asked, a one-page collateral, a piece that we can use to distribute to our communities via print and through our newsletter?
Yes, I do have that. And if you might put my email in the chat earlier, and so if you can email me, I will be happy to send that to you. We also have these little cards that we hand out. So if you want a little card that kind of describes what we do, we can give you a box of these in English or in Spanish.
So I'm going to put your email and stuff again in chat. People can contact you to get that information. It might be something, Bill, that we'd want to put even on the landing page, maybe.
Yeah,
just a link to that kind of thing, We are
working on a new piece of the site, which will probably be available in the next week or two. And it will include a media page where we'll put all of this kind of collateral that people can get to if they need it. We'll also include all the videos from the intersection on that same site. So
great. So Wendy has her hand up. And she's gonna open her mic. Yay!
Yeah, get to my mic. Good morning, everyone. Want to note that Bill Neely will be featured today at the Interfaith San Antonio Alliance lunch meeting at Temple Bethel at 11:30, and he'll be doing a deep dive talking about the housing portal. So this is your opportunity to have more input in how to help shape that developing portal. So reach out to me, let me know you're coming, and there's still room at the table for you.
I'm looking real quick. My city is my home. I'm just looking through the last questions. Can I search for all the neighborhood associations and HOAs to figure out where there aren't any and how?
So neighborhood associations don't often make it into SACRD because they don't, for a couple of reasons. One is that they're membership organizations, and so usually the programs that they have are only available to the members of the neighborhood association. And so that's one of the policies that we have at SACRD, is that the programs need to be broadly available and membership programs don't generally make it. There are a couple of homeowners or neighborhood associations that are offering compassionate services for free to anyone in the neighborhood, regardless of whether or not you're a paying member of the association. And so one or two of those have surfaced. I think there's, and they, over on the west side rather, I think there's a boxing program that's run through a neighborhood association. And but on the whole, those homeowners associations and optional neighborhood associations generally are membership based and exclusive. And so, SACRD is an inclusive platform. And so we generally don't find that those services are compatible with what we're doing.
And so, Bill, will you go like to nonprofits, congregations? How can you help folks in this group?
So we do this. We do an orientation on SACRD. I've got anywhere from a 10-minute to 45 minutes, orientation that we can do that trains people how to use SACRD. I don't presume to train your people how to do their job, but I can train them how to use SACRD. And so I call it orientation to SACRD as opposed to training. But so we do that, and I'll do those anytime, anywhere. Just call me and ask, and I'm happy to do it. And so the other thing that we can do is, we'd love for you to, if you have a website or a newsletter, we'd love to be, included in those. We can return the favor, and then and I have this dream that one day we'll see ads for SACRD on buses. So if you have a bus program, where you're advertising via buses, if you want to share that with me and put me in the corner of your ad, I would really love to talk to you about that too. I can offer you any service you want. If you call me and if you need help with your organization with resourcing, either training or just understanding how it can be used, I'll come out and meet with your people anytime.
Are there any other questions or thoughts or ideas? That works too. Looks good. Well, I sent out in the email yesterday. Wait a minute, we get two here in chat. Oh, I'll refer to you on our newsletter. That's really great, Anne. And there's Wendy's email. So as I mentioned earlier, next week, we're going to be hearing more from what came out of initially the team was homelessness and hunger in 2017. And both of those have grown significantly in terms of collaboration and partnerships. And so hopefully next week we'll be hearing about the homeless efforts and how the collaboration and the teamwork has actually been integrated into the city system, which is amazing, because when I first started working with the city folks didn't know how to find folks in the faith community to work with, or also didn't feel so comfortable doing so. So that has really become more integrated in the work, which I think is very exciting, because then we're just working more fluidly between each. And the following week, we will be looking at not hunger, but how that is strengthened in our community, specifically through the food bank. And that has reached across pandemic and immigration and refugees. And so we're going to be hearing about that development. So Beverly has her hand up at 8:42.
Good morning to everybody. I did want to ask, and if there's a way for us to also take on the topic of youth employment. This, as we're approaching this summer, I was saddened to learn that of all the millions of tens of or $100 million that went to Alamo Workforce Solution, they did not set aside any dollars to do literally youth employment. They had a job fair where people who were interested in hiring youth could come. But as you know, particularly with many of our youth in our poorer communities, number one, they don't have transportation. Number two, they didn't have a way to get to the job fair. Number three, they need assistance getting to and from, they will need assistance getting to and from work. And this leaves a whole sect of our community out, just truly out. So I don't know if there's something we could do in terms of it's going to be a long, hot summer, and that we're seeing the gang participation rise on both the east and west side. And we've got, again, this is perfect time for kids to be recruited when there's nothing else to be done. I will say that West Care is doing a summer extravaganza. It is totally free. Kids are going to be able to get STEM, nutrition, exercise, gardening, etc. We're taking every week for 8 weeks. We're taking youth to a field trip it will be SeaWorld, Natural Bridge Caverns, Wonderland, the Fly Place, all these different things, but it's all free. And I just, because we had to do something, and we actually hired junior counselors to kids to work with other kids, so that we could employ about 25 young people for the summer to be able to, to do that with the kids. But it's a problem, and we really need to figure out what we can do for this summer.
So this couldn't be any more perfect. So
Okay.
this is how collaborations work, or how it's been working for all of us and how it's been growing and evolving. So even back to 2017, what are our community concerns? How do we address those? How do we do that together? So Beverly has raised the concern of youth engagement, specifically in the summer, and that it's and pretty immediate as we're in June 2 here. So I'm wondering, Beverly, if you or someone, you just mentioned you hired a couple people too, but who that might be, if there might be a main contact that people could connect to, since you've raised the concern, that we can start forming a collaborative around that.
Yes.
And okay, if you put that into chat,
I will put
that would
that
be
in chat.
good. So anybody on the screen or anybody you might know, or any effort that's happening, you could then connect to whoever Beverly is putting into chat. And Bill, I'm wondering, because I know that SACRD is always looking for an area or something to highlight. So could that be something that could be highlighted into SACRD on the landing page at some point this summer?
Oh, sure. Yeah, we have what we call the featured program, or the spotlight program, that we put right on the front page, and we usually rotate a few of those around. And so, we try to match those with ongoing community needs at the time. So, so for sure, yeah, we can feature that there.
Great.
So Beverly, I will create a listing for that program today.
Thank you so very much.
So
I'm
that was,
I'm getting the email for Fernanda immediately on this for you guys. So I'm getting ready. Was just getting her email, so I'm putting it on there.
this is amazing. I mean, couldn't be a more perfect example of how that works. And so I would suggest, Beverly, however that starts to flesh out, that there might eventually be a gathering of people who are interested, but just sheerly collecting what's going on out there in terms of young people being engaged during the summer would be a great resource for people. And then that can be posted on SACRD, which also makes me think, so I'm just going to go down the list. I don't know if there's somebody here from everywhere, and then we're going to draw this to a close. But we already know that any of us can contact Bill if we want to know more and connect more with sacred.org. We also know that anyone you're interested in working more in terms of youth engagement, that Beverly has put that information into chat. I don't know if anybody is here with homeless administration. If they are, if you put your name and email in chat, so people could, maybe anybody who's interested in that could do so. I don't know if Lauren is still here, but you could put in information in terms of food and supplying that into the community. Bridges to Care, I know that Doug was here. I don't know if you still are, But if you're interested in bridges, and we're going to be hearing from all of these, but we don't have to wait to hear from them to start connecting and working more. So Bridges to Care, Doug, if you could put somebody's name in there with email, maybe Donna's, whatever you want to do. But if you're interested in that in community, in proximity, mental health care and community development, that would be great. There's still, the next one is Compassionate San Antonio. Right now, that is the Institute, and that's still open for registration. It started on Tuesday, but registration will run until a week from this Friday. And so I'm the contact for that. If anybody's here with the Immigration Collaborative, I'm just going to read down these now. At the Intersection, the Refugee Response, Community Welcome Collaborative, Housing via Faith Community, Domestic Violence Prevention, the San Antonio Story Collaborative, the Healing Community Collaborative. David was with us. A new one was formed last week, and I don't know if Paul is still here, but we're calling it Sane Society Collaborative. So, you know, how do we move forward with events like what happened last week in Uvalde? How can we be more civil? How do we address those things? We're calling it Sane Society. And in fact, Paul being Paul, he dropped the E on sane and made it San Society for San Antonio. But anybody wants to be in that conversation and collaborative, that would be great. It is 8:49, and I hope today was helpful. I also think it would be extremely helpful for anybody who is coming maybe new into this work. So if you're working with people and trying to invite them into this kind of work and what's going on, these Thursdays are going to be a great way to get more people informed. So you might think about that as well. Anyway, I'm going to leave you. Send all good, vibes up to Reno this weekend, especially on Sunday afternoon. That's when they're going to be talking about community collaboratives and compassionate cities. So, and I'll let you know what comes out of that. So have great weekends, and we will see you next Thursday at the Intersection.